Right.
Okay, summer heat. Can you tell I'm fired up tonight? Okay. We have covered summer heat before, right? But I feel like this is so vital. I want to make sure everybody's understanding it because every season people call about this. So many people have this as part of their disease processes. Everybody will experience this almost every season to some degree. I guarantee you, either you or someone in your home will experience this every season. So I just want to make sure everybody understands like the theory and history of what is happening. So first of all, I guess what questions, this is unique to natural medicine. This is part of Greek medicine. This is part of our Western European traditions. But I think in Chinese medicine, the theory of it and the understanding of it has reached its like highest understanding. But what questions do you all have about it? Because I'm sure you've seen people, right? The first hot day, beginning of June, end of May, we had that little first heat wave. Just like clockwork, everybody starts calling the office confused. They think they have the flu, right? They have like the stomach ache, the nausea, the queasiness, the dizziness, lightheaded, or they think they have allergies or something. It's just, really time. So what do you all know about summer heat? What are you confused about? What do you need further understanding of?
This would probably be later on, but I feel like I understand the acute phases of summer heat very well. But I'm confused more about what it looks like long-term and what it can present itself as long-term after you get over the hot flashes, the fever, the stuff that you notice right off the bat.
Okay,
How do you identify it later on?
I think that's a really powerful question. Okay, let's maybe start over and work our way up to that, okay? So just to review the idea, I'm going to use the Chinese medical definition of it because it's so comprehensive. The idea of summer heat is similar to how colds or flus often evolve in our body. The idea that something is coming from the outside of our body and pressing in and creating an internal change. And the only reason it bothers us is because inside we are not balanced with the season. So something like summer heat, this doesn't only happen in summer. You could do saunas. You could do hot tubs. You could be exposed to just over exercising in winter. It's not just summer that this happens. This is when people have exposure to heat and the body is not able to deal with it or manage it. So basically the idea is that this heat comes from outside to inside our body, invades deeper and deeper and deeper as we develop more and more of the problems. Okay, like how a flu in Chinese medicine is thought that will kind of the virus will invade, come deeper and deeper through our body, whether we're talking about our meridian system or our physical body. So everybody's okay with that part of it, right? Summer heat is always going to be compounded by dampness, meaning humidity. So when we have heat mixing with dampness, then we have a bigger problem. That's why the first hot spell we had, like late May, early June, there was humidity with it for the first time of summer, and that's what got everybody. That's where everybody started feeling queasy and all of that. So what happens is, remember in Chinese medicine, we say the microcosm follows the macrocosm. So our body is, whether we realize it or not, every second adjusting to every barometric pressure change, temperature changes, right? You know, and in America, we're going from 100-degree weather inside to like 65-degree air conditioning. And this is like really your body has to like figure this out. It's Most people just don't even think about it. So it's the idea that when our internal body is in balance, certain parts of it can't manage. So summer heat loves to attack our heart. So we get a lot of summer heat symptoms we'll review are related to almost like cardiovascular symptoms. This is also why people who have weak hearts and have had heart surgery and heart complications will often have really reactivity to summer, and they hate summer, and a lot of cardiac patients have a hard time dealing with summer. They get more edema, they swell up, they can't breathe, they become more fatigued, they become more lethargic, they get really irritated if they're in the heat and sun. It's because, remember, the heart has to compensate and deal with this. Our liver also has to deal with this. Most of the liver symptoms we get from summer heat are going to show up in our gut. And then our stomach and spleen and pancreas also have to adjust. So about half of the summer heat symptoms that the Western medicine does not recognize are going to be more probably digestive in nature. So sunburn would be extreme summer heat. Radiation therapy with chemotherapy. These are also examples of how radiation and heat can invade our body and create havoc. So it's not also just summer heat under sun. It's very wide arching theory. Everybody get that part of it? Like if you have sunstroke, right? Sunburn. If you ever had a sunburn, you had summer heat. That's like radiation burn, right? Literally. But what I want everybody to think about is where herbal medicine is really good is that summer heat, as we're going to define it, is like stage 1. All the things we'll talk about. Heat exhaustion is a medical term and a medical condition that we recognize. That's kind of like stage 2 of this. So it's a great example where Western medicine and natural medicine can really support each other. Heat stroke would be stage 3. And we'll help you, medically and traditionally understand these stages. Okay. So what we're really talking about is most people don't recognize they're in stage 1 and have a lot of symptoms, and they have a lot of lingering health complications that can arise from this. But if you go to the doctor, they're only going to recognize it if you're down in these stages. Okay. Everybody's okay with that part of it? We're going to go through all the symptoms. Okay. So if anyone's ever had heat stroke, heat exhaustion, dehydration, radiation treatment, like severe sunburn where you've blistered, like you've had summer heat, right? You've had this. And it's not just athletes, it's not just construction workers, it's all of us have experienced this to some degree. Okay. This I really get excited about. I feel like I was thinking about how to teach this today. I think this is like really the best way to deal with this. The problem is most people don't know what to do at any of these stages, because medically, you're just going to get like Tylenol and IV fluids. There is no other medical treatment, right? You'll get Tylenol to manage a fever part of it. When you get all the way down here, you'll get IV fluids, but really there's no medical treatment. So no other really treatment for it. Okay. So we'll go into all the symptoms again, but this can create, like Victoria's asking, really complicated long-term patterns. This is especially true of people that have had repeated exposure, which is going to be more common in farmers, people that work outside, people who are athletes, people who inappropriately overusing saunas. I mean, it can happen to all kinds of people. But it's probably going to affect the average person of just a small exposure. You're going to be more acclimated if you're an athlete. You'll get kind of used to it. But construction workers, postal workers, people that have to be outside have a more history and usually more repeated exposure. I think if we look at the symptoms, we'll understand how it lingers, because it's going to remain as either. Let's look at the symptoms first, then we'll get there. Okay. So what are all the symptoms of summer heat? The first stage as defined by natural medicine. What do we start to notice? Let's go through every system. Okay. First of all, aversion. What are people going to be aversive to? In the initial stage, people are going to be aversive to heat, right? What about in the advanced stages there? Heat stroke. People are going to be aversive to both often hot and even cold will bother them. They just can't get comfortable, period. That's when people are like on the verge of like losing consciousness, passing out, right? Severe fever. So in the initial stages, in these two stages of just people are really aversive to heat. And if you go into the heat, it gets worse. And you're also aversive to humidity, right? Think of humidity as a way of making heat stick in your body more. Okay, changes in barometric pressure. Even being in the sun for any of these stages is going to make people feel worse. So people will start to just almost loathe the sun. And people that have had severe heat stroke, they often still 40 years later can't go out in the sun. They just hate it. They avoid it at all costs. Okay.
I have a friend who has she's allergic to the sun.
Yep.
She has to wear forehead.
Yeah. So being allergic to the sun is often part of like a summer heat reaction. Okay. So we're gonna let's go into why a little bit more in a second. What happens to your brain with level 1 getting worse as we go through? What else happens? This is how we sometimes recognize in people.
Doesn't it start to heat up itself?
If the brain starts to get hot and dangerous and inflamed, right? What do people start to behave like? What? Yeah, emotionally, people start to get really agitated when they get this super emotionally angry because it's affecting the liver, super emotionally anxious because it's affecting the heart. So we have to understand how summer heat affects, because some people have it bothers more their liver, and some people it's more their stomach, and some people it's more their heart. Okay, but with the brain, we're also going to see memory loss, brain fog. People just start get spacey, glassy-eyed as they're about to faint, right? As it's getting worse, and then eventually with the brain, people can pass out or lose consciousness as this gets worse. Okay. The good thing is, if we're really good herbalists, we can recognize this at stage 1 and just resolve it or prevent it totally, right? Okay. What's going to happen with the gut? Stomach is going to feel nausea, queasiness. This is one of the most defining traits of first stage of summer heat. People start to get queasy, nauseous, and like a low-grade dizziness. People can actually get vertigo as it gets more extreme. Like that. Okay. What else happens to the stomach? Our appetite usually goes down. And guess what? If you have summer heat and it's more affecting your digestion, when you eat, you get more queasy. Right? And guess what foods make it worse? Eating anything that's fatty, oily, greasy, or fried. Why is that? Because those foods are dampening and very damp and hard to digest. We already have this humidity and dampness inside the body. It's just like you're just adding to the fire, right? I had a friend once who wasn't a herbalist, who had severe heat stroke once because he was not acclimated to hiking on the prairie all weekend with me. He just wasn't ready for it. And also tried to drink like a bunch of beer and have fried foods that night. And then that was kind of like part of his diet. And just every time he eat that, he gets so sick. I was just like, okay, you know this? What are you doing? What are you doing? Kept getting worse and worse and worse. Okay. So alcohol usually makes it worse because alcohol is what?
Drying. Dehydrating.
Dehydrating, drying, but also superheating to our stomach and liver. There's no way around it. All alcohol is sunlight, can't get around it. Okay. And it heats our liver and our stomach full. Okay. Okay, so digestively too, we can have vomiting, we can have extreme nausea, we can have one of the traditional Chinese medicine, the main ways we recognize this is nausea, queasiness. People feel like stuck right in their epigastrium. So right in your solar plexus, you'll often feel like a stuck feeling. That's from the heat actually going literally into the stomach area. Okay, so sour stomach, burping, retching, acid reflux, loss of appetite. Very important. As people move through this, all these are going to get worse. Queasiness, nausea, getting dizzy after eating, vomiting is going to get worse as we go through the stages. Okay, that's why we know how we can often tell if it's beginning or late stage. Okay. Also, no thirst, or usually at the beginning stages, there's thirst because your body is trying to cool itself down. And you'll crave often water and fluids. But when you get into stage 3, your thirst mechanism actually stops. That's when we also sometimes know it's getting really bad. By the same token, stage 1 and 2, you're going to feel hot, sweaty. But when you get into stage 3, this is like when we hear about people who die in the desert, right? Start hallucinating. Eventually you stop sweating and you stop getting thirsty. That's only in the extreme stage. Most people are going to be extremely thirsty. People are going to have a really dry mouth and dry lips. The face is going to look very flushed, right? Red. You can often just tell when people have summer heat because they just look like totally flushed and flustered. And they have that look in their eye like they just don't know what, they just look discombobulated. So. Okay. Okay. As the digestive symptoms get more intense, like it invades more into your stomach or liver, then we start to get the diarrhea. This diarrhea can last for years, weeks, months, days. It just all depends on how inappropriate people kind of like move through it. To me, this is like one of the basic skills people need to know to live as a human. Summer heat and the idea of how to manage it. Okay. Okay. This diarrhea and nausea usually do not respond to taking any kind of prescription medication. Meaning you can take like Imodium for the diarrhea, it'll help, but it won't really resolve it. You can take nausea medications and it won't usually help this type of nausea. That's sometimes like a good tip off that this is what's going on. People can take acid reflux meds and they still feel really kind of sour stomach. Okay. So psychologically, what happens? If it's going to get to our heart, what symptoms do we start to experience? Remember, these are all on a continuum. So first, we're going to start with what do you think with the heart? We're going to feel anxiety, anxiousness. Restlessness is one of the traditional words that I love here. Because when people do have this, you'll notice like when people have summer heat, they just like can't get comfortable even when you're cooling down. Like even if you get up to walk, you feel like queasy sometimes. You feel restless and you actually want to like thrash about. And when people sleep at night, they'll start to develop insomnia from summer heat. And very restless, like thrashing about at night and can't rest and in and out of sleep, really vivid dreaming, like really wild dreams. Because remember, eventually we're going to end up in delirium. We're going to end up delirious and hallucinogenic. If it's not treated medically, rarely gets to that stage from people. But okay, so we're going to have excessive thinking, excessive worrying. In the initial stages, people just can't think straight. They can't make up their mind about anything. Indecision is huge. That's when it's affecting your spleen and stomach. Indecision. Sound familiar? All right, have this right. And we said with the liver, as the liver becomes more affected, people are going to get more and more irritable and to the point where it's going to become like angry and then eventually like kind of explosive. Okay. Okay. What about the heart? What happens to the heart physically that we're going to feel? We're going to feel like this pressure, like an achiness. A lot of patients describe it. I've had this before, so I know this very well. Feels like a stuffy feeling in your chest, like you can't like. It doesn't necessarily cause shortness of breath, but you can like feel like you want to like massage it away and it doesn't massage away. It's not a tension, it's almost like this stuffiness that you can't like fix. And then eventually, as the symptoms progress, if you're not treated or you're still in the heat, it's going to start to develop severe heart palpitations.
Is that more stage 3?
A stage 2 to 3, you start to get fluttering on the heart and palpitations. And this is where a lot of dizziness will come in too. People that have this really bad, they'll be really weak and they'll kind of get up and they'll start to try to take some steps and their heart just like flutters and they feel like dizzy. And if you're like already a heart, patient, then it's going to be more likely. We get like dizziness with standing and moving. Okay. Eventually we could get possibly elevations in blood pressure in these later stages. Okay. With the heart, at all stages of this, guess what happens to the pulse?
Becomes rapid.
gets more rapid, gets faster immediately. And then it gets even more fast as we move through this. So sometimes heat stroke and summer heat will even look like heart attack. This is why, like with cardiac patients, it's always like they get really triggered by it because they've had a history of like heart attacks or heart surgery. And your heart's doing this and you're dizzy. So I mean, I've seen so many cardiac patients that all summer, they're kind of like going back to the ER with things like this. So. Does everybody get that? What do we mean by fast pulse? Way more than 70 beats per minute. As we get through these stages, we're getting up to 80 beats per minute or higher, then maybe super fast. Guess what happens at this stage though? So the pulse is going to be really excessive in these stages. When you get to this stage, yes, the pulse is going to get really weak. And it will slow down sometimes, and sometimes it just totally disappears, like you can't barely even find a pulse. So, but in most people this is gonna be when people are about, having to go to the hospital or something. Okay. What else is gonna happen in the pulse? This is really important. This is maybe one of the defining traits that you're really good at the pulse. Want to know one of the greatest tips ever? You'll never see in any textbook. This I really mapped out myself really well. So in the first stage one, when people first get this is how we can tell immediately if people got summer heat, even before they have their first symptom. They'll have the floating pulse. Remember we talked about with colds and flus, how people have a floating pulse. 1 minute review here. Remember, if this is someone's pulse, this is the top, right? A floating pulse is where we feel the pulse way up on the surface of the skin, not in the middle depths and not all the way down to the bone level. This is the same type of pulse we feel when people first contract like a virus or a fever or an infection. This is why I think Chinese medicine is so unique here, because it learned how to like understand this so well. Because remember, the top of the pulse, this is the surface of your body. So this is telling us that what do we call it, pathogen or the influence is pushing in, getting into our system. You always feel this right away. Okay. This is where people just start to get like hot, flushed, maybe a little bit queasy. But then I realized over the years, before people get to a medically recognized stage, there's this intermediate stage where this goes away, this floating pulse, and then you're gonna feel this very damp, soggy, excessive pulse in the liver and stomach and spleen bowl. Do you remember the liver pulse is on your left side in the middle, the spleen and stomach pulse on your right side? So the middle pulses of the body, which are going to rate to like the middle part of your body, get really damp and excessive. Let's review real quick. I really like this. I don't want to lose this chart. How are we going to do this? Okay, we're going to lose the chart. Okay. Here we go. So this is your, let's say, your left side. As you all know, I'm a terrible artist. Okay. Your right side in the middle area of the pulse position, right? You're going to have your spleen and stomach. Remember, we have 3 levels to the pulse. Here we have your liver, gallbladder on your left side. So remember, in general, the upper pulses, the upper part of the body, the middle pulses are in the middle part of the body. The back pulses are the bottom part of the body. One way to look at the pulse, the other way to look at it is the top is the surface of your body. The bottom is the deepest parts all the way down to your depths of your bones. So there's different ways we look at the pulse, we can dissect it. So at the first stage, we're gonna have stage one. We're gonna have this floating pulse, especially on the left side. And remember, we said floating means we can lightly press on it and feel it with hardly any pressure. And if we press down to this depth, it goes away. You don't feel it at all. Remember we talked about that with pulls and blues and. Okay.
I don't
think we talked about this. Let's bring it up.
Doing it. Especially gonna be on the left side, possibly the right side, but not as common. This means literally something has invaded our pores, our body, and gotten into our system from outside of us. Okay. So floating means it's like a piece of wood floating on a water. So you feel it when you press it, but if you go down deeper, it just the pulse disappears. There's nothing under it. So probably not any floating pulses in class because no one's probably has like acute allergies or flu or cold or summer heat. Okay. The second stage, the liver and spleen, the pulses start to look and feel like this. Pushing upwards. Very damp, which means the pulse will be like really thick. Moisture makes our pulse really thick. It's going to be pushing upwards. It's going to be, remember how we talked about the strength of a pulse? You know, you're talking about on a scale of 1 to 10, it's going to start to get into like the 4, 5, 6 range. So as we get into step 2, stage 2, and it gets into our gut, this is how we know it's happening. Both sides will look exactly the same and feel the same. And that's how we know it got into your gut right away. Remember, we learned this pulse by taking the pulse of people who are just coming down with a cold or flu, people who just got radiation therapy or just got a bad sunburn. We can feel this. Train ourselves to feel it. This we feel when people have like diarrhea, nausea, queasiness. We can usually feel these types of pulses. So if you remember, we briefly kind of talked about this. This pulse is going to be, we call it damp, would be an easy word to describe it. That feels like a caterpillar. Remember how we felt that in somebody? The caterpillar eating a leaf. It's very soggy, it's very wet, very moist. Okay. Just put it in your brain and just accept that. Okay, just download it. Just know that that's just reality. Okay. Okay, I doubt somebody might have this pulse, but we might be able to just do it in a minute. Okay. But as we move to stage 2 and it gets more into the gut, this is going to start to show up more and more and more. So this gets more into the long-term diagnosis of it. It starts to still, these things will linger indefinitely. Okay, so okay, this is a theory. What if we had somebody that had severe summer heat, moved all the way to like stroke, right? Severe fever, like heat stroke is medically defined as like a fever over 103, like almost loss of consciousness, you know, elevated pulse rate, sweating, all these things. So what's it going to look like if somebody came to see us and it's 30 years after their heat stroke but they're still having, how do we know, first of all, without even being a pulse master, that somebody had this? How do we know it's still bothering them? Yeah, we just say, hey, have you ever had heat stroke, dehydration, heat exhaustion? And they say, yeah, I'm like, well, does do you still bother you when you get overheated? Yeah, I get all these symptoms. So we don't have to be a pulse master to be able to know it's still affecting them. Okay. Then we ask like really specifically, well, like what do you get when you get out in the heat or when you get overheated? Maybe they'll talk about their heart more so, like feeling congested or palpitations or dizziness, or maybe they talk about more about the emotional anxiety they get. Maybe they talk more about the digestive symptoms, so we can kind of understand where this effects landed and still staying, even if we don't get really good at the pulse. Okay,
So
but yeah, go
if
ahead.
they have these effects 10 years later, are they gonna be more of the effects of the summer heat or the heat exhaustion? Like stage 1 effects or stage 2 effects, or does it depend?
All stages can cause long-term lingering complications. But the more severe you go, the more likely it is that they've had permanent damage.
So if they had heat stroke at one point.
Yeah.
And it's been 10 years, are their symptoms gonna look more like the heat stroke ones, or are they gonna look more like the summer heat? Does that make sense?
Yeah. So to me, yeah, I guess what we're saying is that summer heat is more the initial beginning stages. As we go down, everything's just, it's the same symptoms, they're just all intensified.
So if they had heat exhaustion 10 years later, the symptoms are still gonna be the heat exhaustion symptoms.
Yeah,
They're not gonna be the summer heat ones, they're gonna be heat exhaustion.
yeah.
So there's
they're-
similarities between the two.
Yeah, so they're all the same, really. It's just that, you know, at stage 1, you're gonna feel hot, but by stage 3, you're actually gonna have like an intense fever that you're burning up, like medically speaking.
Sure.
So like at the first stage, you'd be dizzy, but like by stage 2 or 3, I mean, you can be where you're about to get vertigo and pass out, or you can't even stand, you know what I mean? So it's all the same symptoms, they just get more intense as you go through this.
Wonder if your
That makes
body can't acclimate, what stage is that?
What's that?
So if your body temperature keeps going up and down and you can't get it to just
Yeah.
relax.
So far. Okay, so first of all, does everybody get this? Victoria, does this answer your question? So. And does that answer your question?
Kind of, I just
So
wanted
if
to
she
know.
gets any of the symptoms, even just, you know, like the dizziness or heat from, even just feeling overheated really quickly from being outside, there's still a residual effect.
So like, I have a friend who gets vertigo if she's outside in the heat too long.
Yeah,
So she probably had
Most definitely.
exhaustion at one time, and that's just the trigger of,
yeah.
Yeah.
And that vertigo is probably more related to the heart symptom usually.
okay. Yeah, I was gonna answer that
Okay.
question. Thank you.
Okay, so just theoretically, to throw this out there, we would be able to, if someone had severe heat stroke, is either going to severely impact their heart, which would also be your brain, right? Your heart or brain, or your stomach or spleen, or your liver or gallbladder. So that's where the symptoms are gonna land. So we would feel those disturbances in those organs specific. So it may be different for any person. Yeah, and remember, this is all about weakness, right? The body is imbalanced and not able to acclimate to it. And in an ideal world, we should just totally be fine with every weather change if we were perfectly healthy. Remember, in Ayurveda and Chinese medicine, health is also defined by how you adjust to all seasonal changes. That's actually a definition of health, that you should be able to acclimate to hot, cold. You shouldn't have to wear winter coats like that are this thick all winter, right? You shouldn't have to be in the air conditioning all summer. You should be able to just acclimate. Because that's a sign your body is adaptable to everything. Right? That makes sense?
Yes.
I think it's lost a lot.
So what stage is that then, if your body is trying to acclimate? is that considered, what stage is that, and is that, what do you think?
Yeah.
It's
so-
still lingering for about 2 or 3 weeks.
Mhm. Yep, so it's still lingering for about 2 or 3, it's either gonna be still. Maybe what we call smoldering in the heart. Or probably, I don't know, stomach or spleen or smoldering, something.
So middle level, what do you think, or just beginning some?
Any stage, yeah. Yeah. Yeah, but most people don't experience all the way to stage 3. Probably unless you are like an athlete or construction worker or something, or you're really some military training or something where you just. Gotta do it.
Cause I'll see people come off a CrossFit workout and.
Yeah.
Straight up hypoxic, they can't keep a conversation, they don't even know their name.
Yeah.
Which to me, I'm like, yeah, don't do that, but,
Yeah.
they're idiots.
Yeah,
But,
even like working out intensely, which is a good thing, but I mean,
yeah, there's
just
two
not
sometimes.
doing it in the right, not working out at 12 to 1 in the afternoon in the blazing summer, like that's like asking for trouble, right? Yeah. Okay. Okay. So even sunburn, right? Because when you get sunburn, what happens, right? Severely. Just like radiation, you get nausea, you get queasy, you get super hot, you get a fever, like that means, what I'm saying, this is sunburn, this is all of it. Okay. Okay, so the question that's already kind of been posed is how do we prevent it? How do we help our body acclimate? That's what the first part of class was about, the summer, right? We're gonna change our diet. Our diet's gonna become what? More vegetarian-like. A lot of vegetables, a lot of fruits. Not eating a lot of meat, maybe some fish. Eating some raw foods, eating salads, eating things that are very cold by nature, which we normally would not do otherwise. Okay. We are also going to eat specific foods that we know are super good for regulating our body temperature, which are what? What foods are the best foods if we're gonna go out in the sun? Like if we have children, if we are a coach, like what are we gonna try to get people to do, even if they don't understand this?
Eat watermelon.
Yeah, so our major foods are gonna be watermelon, everything in the melon family, muskmelon, Santa Claus melon, antelope. Santa Claus melon is like kind of like a cantaloupe, but different. Honeydew. Mhm. All of the bitter salad greens like endive, arugula, collard greens, chard, radicchio, right? Although it's the same list we have from our summer cleanse program, right? What other foods are especially good for summer to our body? Cucumber, yeah, one of the best. Aloe vera juice, aloe vera water. Yeah. What else?
Radishes.
Radishes, like kind of watermelon radish does a little bit, yeah, but radish is a little bit, yeah. Tomato is actually, remember, very cold, very cooling, a lot of salsas, really helpful, right? We're going to avoid food that is super fried, fatty, greasy, oily. So that's the worst thing you could do.
It's funny when you go to a carnival in the summer.
It's like the opposite of the carnival, like eating fried corn dog or fried Oreos. It's like you're just, yeah, it's like the absolute worst thing you could do for summer heat. Another food that's overlooked a lot is, tofu. Again, if we're gonna eat tofu, it should be non-GMO organic. It's gotta be really, and that's not something we eat a lot, but occasionally. What else? One of the most powerful foods that's overlooked a lot is mung bean. mung bean, the green mung bean that's used a lot in making different types of mung dal, right? And Vedic cooking and in kitchery, it's one of the most, that's why it's in kitchery, right? Because it's cooling to the body. Mango, pineapple, lemon juice, lime juice. In Indian cooking and in Chinese cooking, they eat a lot of bitter melon also, very powerful food, eggplant. Those are all very cold, cooling foods. Tomato, I forgot to put tomato on this list. Coconut milk, coconut water. The prime people, they had to just. Whatever that guy is that made the prime drink, their good drinks, they got the coconut water, and then they had to put all the artificial sweeteners in there. The Greeks would call that the shoes. Coconut water, that's all they needed. So coconut water, one of the most supreme foods, right? Okay. Okay, what about what herbs are we going to use to treat this? Let's try to do this differently than we've ever did. Let's break it down a little bit. What herbs, if we're getting a lot of the cardiac symptoms, are we going to do? Hawthorn, linden, yarrow. Remember, yarrow is a major summer heater. One of the main herbs for treating summer heat, reducing summer heat. In Chinese medicine, instead of yarrow, they use what herb that's legendary for summer heat? Chrysanthemum flower. That's why when you go to the Asian grocery store, right now they're selling chrysanthemum drinks of all kinds, because a lot of people from Asia now drink chrysanthemum in summer to cool their body. Okay. So when it's affecting the heart, we're going to go more for yarrow. Hawthorn flower berry, linden flower. Hibiscus flowers, good when it affects the heart. Okay. So if we had to choose one summer heater for the heart, it's yarrow. I want to emphasize it that much because it's so cold and cooling. And it's also digestive bitter, so it really helps clear the gut. So, okay, what about when it's the liver and gallbladder? You're getting, diarrhea and loose stools and nausea and queasiness. Headaches. Headaches are going to be more common with liver summer heat. What we got? We're talking really a lot of bitter herbs, right? Mugwort, one of the most cooling bitters. And we're talking about the more extreme bitters we've talked about. Wormwood would be the other one that's really powerful. Prairie white sage would be the local one we would have. That's the digestive bitter that's in the wormwood family that we would use. What's that?
Wild lettuce.
Wild lettuce a little bit, yeah. Yep, wild lettuce leaf would be kind of like a secondary cooling one. We get it out a lot. Okay. What about if the summer heat is getting into our stomach? It's one legendary herb. So peppermint or wild mint. And then the other one that is so specific for summer heat is anise hyssop herb. Very special herb. Especially when people are queasy and dizzy. When summer heat gets into your ears, because people can get like inner ear conditions from summer heat, anise hyssop is remarkably helpful. Okay. Okay. Another one, what if it gets into your kidney? You're having like burning urine. Feels like a UTI and really dark, brown, yellowish, concentrated urine. Sometimes like a lower back pain. Special, it's a food, right? Watermelon. And watermelon seed. Remember, we always eat the seed. Watermelon. Because that flushes heat from our kidney. The other one that's in bloom right now, starting to happen, is sumac berry. Is what local tribes would have used for summer heat. It's called often Native American Gatorade. Drink it to cool the body, to cool the kidney down, to get electrolytes into your body. You know, they didn't have coconut water in this part of the world. You know, they had no air conditioning. They really had to deal with the elements, right? Okay, what if this sucker starts to go sideways? This is what I want you all to know. What if it's getting like really intense? Someone's like to the point where you feel like they got to go to the hospital, or they've been in the hospital and they're just like giving them IV fluids, feel a little better. You know, where people are still really dizzy or really queasy, or diarrhea is not stopping. All those things, dizziness, vertigo, heart palpitations, feverish. What do we do at this stage for summer heat? So most of the herbs we've talked about, if you notice, they're all diaphoretic. The herbs we do, but the onset of colds and flus, the lower our body temperature and creates sweat, right? Then we're going to, if someone comes to see us and they've had heat stroke 10 years ago and still dizzy or having symptoms, these are the herbs we're going to do to clear the memory of it, of the body, or to manage symptoms that are getting worse. Yeah, my one friend I talked about that wouldn't quit eating fried crap and French fries and drinking beer. Eventually ended up helping him. I think I had a combination of like willow bark, because that's like a strong febrifuge, and anise hyssop. And I think I had some yarrow for the heart, and that totally finally cleared his whole life. And he was to the point where he'd even sit up in bed. He was so dizzy he had to like lay down for like a week. It was going on for a really long time. Okay. We're going to do, willow is absolutely amazing here. I've used it so many times when nothing else would help people. Remember, febrifuges clear heat from deeper within our organ systems.
So this would be good for headaches because of heat as well.
Yes. Yeah. Cottonwood would be another local, cottonwood bark, one of my all-time favorites that we could use with willow bark or in place of. If we want to really get nerdy as a herbalist, willow bark, a little bit better for the intestines and the liver. Cottonwood, a little better for the extreme heart heat. Okay. Okay, what if all else fails? What if the willow and those things help, but people aren't totally out of it? What's the magic secret remedy? Then we're going to do enjada bark, very low dose of it, or have people drink tonic water. Right? And remember also green tea in Chinese medicine is a major cold herb, very good for preventing summer heat. So drinking like ice cream tea or green tea in summer, even though a lot of people don't like hot tea, very helpful to cool the body down, to acclimate it. But the goal is before we go out into the heat, we're gonna hydrate, right? We're gonna have electrolytes. We are going to be sensible, right? Like not overdo it and act super tough and try to out hike everybody with it's back up, right? Those kinds of things when we I think Noreen's inner tube pop, somebody's inner tube pop. I had to hike the whole river down, like ran the whole way. But I was like, I got summer heat that night, actually. I was like, just a little bit. Okay. Now, traditionally, a lot of cultures in summer eat spicy food. Why does that make sense? It's somewhat counterintuitive.
Makes you stuck.
Yeah, so traditionally, the spice would be level, right? Meaning, if you look at like Southern Chinese cooking and Southern Indian cooking, super spicy, like in the tropical parts of Asia and India, because they have just found over the years that eating some spice, even though it's heating, it is still like creating a little bit of a sweat to keep your body temperature regulated. But as a herbal medicine, that's not the best strategy, right? The best strategy is maybe a little bit of spice. But if you're looking at the foods they're spicing, they're not spicing like meat. They're spicing like more like really cold vegetables like tofu and vegetables and bean dishes that would have a lot of spice. It wouldn't traditionally be like meats necessarily. Okay. Okay. What's our cheat sheet? Okay. How are we gonna cheat the system? What if we're just like, what if it happens to us? Because when stuff happens to you and you're the herbalist in your family, and your brain's not working. I did this before. I'm just like, I don't know what to do. I can't even think about it. Yeah. So what is the cheat sheet to like maybe prevent summer heat besides the diet, besides the lifestyle? What are some other like drinks and foods? We can do tonic water, or we prefer like Q-tonic, tonic water. What's that?
Coconut water.
Coconut water, yeah. The juice everybody should be selling this time of year is like watermelon juice. You can buy it now at Whole Foods, but if you're gonna juice, I mean, that's the juice to do, is watermelon juice. I mean, these three alone really have a powerful thing. Remember that tonic water with lemon, remember lemon juice is very cold. It's one of the OG, one of the original summer heat preventatives, because it's cold, keeps your liver and your stomach cool. The bitterness of the tonic goes to your heart, the tonic water. So like tonic water with a little lemon juice is a really good preventative. Okay, or these are things we can maybe get somebody to do without knowing it, like family or friends. Okay. I know tofu and soy has like a lot of controversy about it, but in emergency settings, or if we have to be in heat that we know is going to be challenging, tofu is like the coldest food on the planet. So we could do a little bit of like non-GMO organic tofu, like single serving or something. Okay. What are other herbal cheaters? Like if we just can't think about it, how are we gonna treat it?
Anise hyssop.
So anise hyssop, if we have to throw something at it, anise hyssop is gonna help all of it. Yeah. And yarrow is gonna kind of help all of it. Okay. Or
Want to do
What about
something really?
ginger?
ginger is like, kind of like, okay, the fresh ginger.
First ginger, when people get the queasiness, the non.
Yeah, we'll often combine a little bit of fresh ginger with everything. Yeah.
What about something that's cold, like golden seal or?
I mean, golden seal would be good when it moves to that extreme where people are needing like little bark or something. Yeah. The other cheater is, this is like the ultimate cheater, right? Is digestive bitters taken with all your meals before you go out, and like a couple days before you're going to be exposed to heat, when you're in the heat, and like a day or two after you're back. A good digestive bitters, right? That's more cooling and really well balanced. So Digestive bitter is a great, this is the way a lot of cultures do this, especially through Europe. We could do digestive bitters as a first stage of treatment if we don't have access to other stuff too. Maybe you're traveling and on the road and you can't get anesthesia. You can always find like bitters somewhere, right? The other cheat sheet that I always tell everybody is what's called hearing pill. Hey, Rach, you grab a peaceful earth
Sure.
or peaceful earth. This is kind of like the best of Western herbalism cheat sheet. This is like the best of Chinese herbal medicine cheat sheet. These two formulas, the bitters and the curing pills, or these are like the same formula pretty much. This is like an ancient Chinese formula for pretty much, we talked about it before, any kind of digestive problem. But it's really specific for summer heat when it gets into your gut. This is like a really complicated, and anise hyssop is one of the main ingredients in it, by the way, too. But it's a very complicated blend of like cooling herbs with a little bit of warming, designed to like clear heat and dampness from your entire digestive tract. So if you're having a lot of headaches, like the bitters are really good. If you're having a lot of digestive symptoms, bitters or the curing pill, peaceful earth is a good cheat sheet. What if it's the heart? Probably the best would, be linden. Maybe yarrow. Or hawthorn. But it has to be hawthorn flower. Or flower in it. That's the part that's really gonna help clear the heat from the heart. So this is your cheat sheet, okay? If you're in an emergency or you're traveling. This is why I always travel with digestive bitters and peaceful earth. Just so you can use it for any kind of emergency too. Hearing pill, you can sometimes buy it over the counter brands. Even like at natural butchers and stuff, or some company that makes it.
Where do you get the curing pill?
Those we have here, but sometimes you can find it at like natural grocers or some off brand that makes it. Oh, by the way, there's a company in America that makes this. Also it's called Stomach Cheat. It's the same formula. But you can get it like at natural grocers if you're traveling. But peaceful earth is my favorite one, but the curing pill is good. I haven't used the stomach cheat a lot, but I know the company is good quality. These are just good for your first aid kit. Remember, peaceful earth is kind of like cheating. Remember, it treats like everything. Stagnation in your liver, stomach, cools the stomach, cools the liver, cools the colon. It also has a little bit of a warming counterbalance. It's good for vomiting, diarrhea, nausea, dizziness, vertigo, food allergies, food poisoning, stomach flu. It's kind of like a cheater. But bitters are kind of similar to that too, right? Yeah.
So for like construction workers who are outside.
Yeah.
Or somebody else.
Mhm.
Anesthesia and yarrow, would it be better to do tincture and just have it ready instead of doing tea?
Yeah, the tea is always gonna work better for summer heat, but the tincture will still work really well.
Okay.
Because the tea is gonna be like in a perfect world.
Right.
Yeah,
What's
so
in
if
part
you're
of
drinking
that?
that iced, like drinking like, anise hyssop with mint ice. Like when I lived in Texas, I mean, every restaurant had like mint hibiscus tea, and she's like. Yeah, that makes total sense. Why are we not doing this in Nebraska?
Would it be good to like almost have it as bit of a hydrosol as well?
You could do hydrosols too, yeah. Doing mint like on your body is really helpful, especially the back of your neck. That's the part we want to keep cool. Like if you have a cooling towel, my softball daughter had a cooling towel. I'm like, okay, I can get on board with this. This is not just fashion, So you have like a cooling towel, but cooling the back of your neck. Then we learned from military vets too, like cooling your wrist is also a very good way to bring your body temperature down. And you know, the other best way to prevent summer heat is to just swim in long line because you're swimming in cold water, like cold spring water. That's really one of the best ways to do it. The only problem is that doesn't clear the from years ago effects, right? Okay. It's a lot to cover in 1 hour. I think we did it. Questions about that? Because this is something, like I said, every person's gonna experience. Almost everyone in your household's gonna experience this or have.
So, like I know women who like their periods get waves in the heat without
Yeah.
the liver.
That would be more liver, yeah.
Okay.
So that, yeah, the question is, some women during the heat of summer, their periods cramping will be more intense. Bleeding is often heavier because heavy bleeding is a sign of heat. That's how the body clears heat. So yeah, for that, it's more the liver and the like the wormwood,
Okay,
yarrow are gonna be really helpful for that, those two.
what about,
Or mint, I mean, just good old mint.
a client who she takes hormone replacement stuff and
Yeah.
she's a sun worshiper.
Mhm.
And she's once it started really kicking up. She's bruising easier,
Mhm.
and would that be liver stuff too? Or is it a
That
whole
would
different
be-
ballgame with hormone replacement stuff?
No, it's a little different, yeah, with hormone, the hormone replacement's gonna still mimic a lot of the liver symptoms of some.
Okay, and do you avoid herbs that you would avoid when people take blood thinners or hormone replacement stuff?
No, you don't, yeah, with hormone replacement, you don't have to avoid blood thinning herbs necessarily.
I mean, even if they're bruising.
Even if they're bruising,
Okay.
yeah, just different, yeah, because remember, the herbs aren't like truly blood thinners, so
Right,
usually safe, unless someone's doing just like crazy.
okay,
I've seen people take like 6 fish oil a day and like that's can have like blood thinning real properties, but you'd have to take a mega.
you don't need to use the caution that you would like wear thin or fluid or something like that, okay?
Yeah, no, none of those was some of the blood thinning type herbs. Cool, I think we did it. I mean, just drinking mint too, I mean, that's always just a great way to manage this. Mint tea, mint on your face, right, mint bath. Really, really help you getting to do. Oh, one other thing we forgot. Ready? Okay. Knife therapy. Knife had a really easy therapy for summer heat. Cold compress on the heart. It's the simplest thing. I don't know why it works so well. I just have had to accept that it's magical. So where you just take a cold cloth, put it right down your sternum, right over your heart to lower your body temperature and fever. It's extremely helpful.
I have hot flashes, that one.
Yeah, so it helps your hot flashes. to
Yeah,
do a
I
cold
remember saying it
compress.
last year
Yeah.
and I think I had a cold, hot stuff, but
Mhm,
and it definitely worked
mhm,
immediately.
mhm.
Sometimes I'll put my.
Yeah, we're ready.
Leave
meeting.
Yeah, yeah.